Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about Hashimoto's thyroiditis and chemicals. How many different chemical compounds are out there that can affect the human body? Specifically, Hashimoto's thyroiditis or the thyroid gland. When we look at all the different chemical compounds, we have so many different things in our environment. We're basically bathing in it. So let's go and take a look. If we look at things like aflatoxins, aflatoxins are found in grains that are stored in those big silos, right? Stored grains, sometimes in dairy, vegetable oil, and cosmetics, right? So how many people eat grains? How many people eat dairy? How many people have vegetable oils? And how many people put on cosmetics, right? You can have potential exposure to aflatoxins. Aflatoxins are basically things like mold and mold funguses and mold spores, right? So we are looking at aflatoxins. Another one is formaldehyde, found in adhesive, fabric binders, shaving cream, and in drinking water because it leaches into the water supply. Trimellitic is PVC pipes, fiberglass, tanning agents for leather and so forth, perfume, insect repellent. You think about how many chemicals are really our bodies being exposed to on a daily basis, right? Isocyanates, upholsteries, mattress foam, window and wall insulations, carpet adhesives. When they put the carpet down, they put adhesive down, right? These are all things that can give off chemicals. Benzene, cigarette smoke, gasoline fume, exhaust from cars, pesticides, glues, right? Bisphenol A. Now, bisphenol A is big. Plastic water bottles, coating of beverage cans, sales receipts, right? You know those receipts that you get whenever you purchase something? Bisphenol A is a very big component of the chemicals that are in our environment, right? How many of you drink from plastic bottles? How many of you cook in plastic Tupperware, right? These things are leaching into our food and water supply. If you are concerned about your thyroid health, you need to remove all types of plastic from your food supply. Water, food containers, etc. Go to glass, stainless steel, right? You have to go and shift your storage containers, right? Because this plastic is leaching in. The bisphenol A is leaching. Bromine bisphenol A. Electronics and soil and food contamination, right? Gets into the soil. How do we dispose of our electronics, right? Gets into landfills and so forth. Mercury, amalgams, fillings. You know those silver fillings in your mouth? They can be leaching mercury into our system, right? Medical implants, water and soil contamination, right? There is a lot of mercury. As a matter of fact, I bet that 99% of us has some sort of mercury in our system, right? Things that should not be in our body. Mercury is very prevalent. It's there, right? It gets buried into your tissues, your organs, your bone, right? Or bone marrow. Another one is parabens, cosmetics, shampoos, skin moisturizers, food additives, right? Parabens, mercury, bisphenol A, cigarette smoke or benzene are very prominent within the environment, right? You have to shift your thought and mentality in order to minimize your chemical exposures. If you have a thyroid problem, you need to shift your mindset. You have to shift your lifestyle in order to get better. These chemicals that get into our body obviously has a detrimental effect. However, your body also needs to clear this out because everyone is somewhat exposed to this, right? Even I am. So if we're exposed to it, your body needs to be able to clear it, right? Through hepatic transformation, right? You have to clear it through the liver. You have to make it from fat soluble to water soluble. Your gallbladder needs to contract. You need to have proper bowel movements so you can excrete things out of our system. You need to sweat in order to get it out of our body. So sweating, bowel movements, kidney function, hepatic function, these are all important factors in getting these toxins or chemicals out of our body. But the number one thing is trying not to be exposed to this, right? And there are simple things you can do. Avoid plastics. Don't smoke, right? PVC piping, adhesives, mercury, amalgams, right? These are the things you can avoid, right? We don't want to be bathing in this stuff. It's detrimental to our health, especially our thyroid health, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. We'll see you guys next week on the healthy side.